bring us up to standards, the national standards, to be in compliance with that law. So again, we have until June 30th to be in compliance.
Okay.
And we've been working on this throughout the pandemic with implementation and development of that program, CARES program.
What is the average time that it takes someone to go through that process? And particularly what I'm curious about is how that holds up other components of whether that be workforce development, right? Getting new workers on, but also our foster parents, right? So as a former foster parent with the state, and somebody who still does mentorship through the University of Kentucky, I just talked to a family the other day that it took them 14 months to get through the process. And I know the extreme need that we have for good quality homes. And to say we are on a shortage is an understatement. But I'm just wondering what we can do to help expedite that process for our families.
So we have been, like I said, working during all along to build our capacity within the care system to make that process easier and more quicker. If it's an in-state background check, those are done, I say relatively quickly, but within 2 to 5 days, usually within a week's time frame. But if it's, and that's, like I said, that's our average turnaround time. But if it's an out-of-state request, then that's where we have to involve KSP and some of the FB, those pieces, and those can take longer. So if an individual has lived out of state within the last 5 years, then we have to complete the out-of-state background check, and that can be take longer to get back. We're dependent upon other agencies.
Will individuals continue to have to come to their headquarters? So in Jefferson County, that's the L&N building, right? That's where I did my fingerprinting many moons ago. Or do we have any sort of flexibility to be able to have people dispatched to individual, you're doing your I've blanked on the word, but basically your home inspection or your home check, right, where your social worker is coming in. Do we have the ability for those individuals to do that, or for a specialized person to go to those individual homes to do that, to help move that process along? Do we have any ability to be creative or flexible?
Not yet. The CARE system is within the Inspector General's office. It is an improvement over some of the manual checks. It also is what's called a wrap back feature. So if something happens later on, it will inform that there's something happened. So that will be an improvement, but we haven't in that system got to the point where that's a mobile system. It just isn't yet.
Thank you.
Mm-hmm.
Please continue.
And lastly, impacts to our public assistance program. So with the end of the public health emergency, we'll be reinstating the Supplemental Nutrition Assistance Program, the SNAP time limits. So adults ages 18 to 49 who are subject to the general work requirements and who do not have dependents, who we refer to as ABODs, able-bodied adults without dependents, can't receive SNAP benefits for more than 3 months within a 3-year period, unless they are participating in an ENT or other educational or work, either paid or volunteer for work requirement for at least 20 hours per week on average. So those time limits and requirements will be back in place. We also have increased Kentucky Work program outreach and engagement to increase work participation ahead of the unwinding. Work requirements for KTAP recipients who are work eligible went back into place last July, and recipients had until November to meet requirements or would experience penalties or disqualifications beginning in December. And then lastly, just want to mention again, the lack of child care options has been, we've talked about that repeatedly as a barrier and one of our biggest benefit cliffs, and that continues to be a barrier to work participation.
And just like public health and the grant funding, the debt ceiling limit place some additional work requirements around SNAP that we're still figuring out, as well as TANF. So those two pieces we will of course be implementing as the debt ceiling and the rules come out about that.
Any questions, comments? Getting a little premature earlier, but again, thank you for your presentation today and the valuable information you provided us. I think it's already helped us put some things into focus as to what's going to have to be a priority for us this next legislative session, but this is a work in progress. And so we move on to next steps, and just a reminder that our next meeting is July 24th, 2023. I would encourage our committee members to look at the charge of this committee. I think what you provided, because it can be kind of wide, kind of unwieldy, but specifically, not to preach to you, but our task force shall examine the structure, operations, program, policy, and procedure within the Cabinet for Health and Family Services, determine if or how service can be delivered more effectively and efficiently, examine Kentucky's benefit cliffs, and continue the work of the Power Benefits Cliff Task Force. So a wide charge that we have before us to that end. Between now and the next time we meet, if you have any particular areas that you would like us to take a look at or concentrate on, please let myself know or co-chair Meade, and we'll try to incorporate that into a future meeting. But with that, we'll be working on the agenda and get it out to you just as soon as possible. With that, any other questions, comments for the good of the cause? If not, then we'll stand adjourned. Thanks everyone for your participation today. Thank you.